it's really critical that you're using excellent technique. If you don't have even pressure, you can cause inflammation as well. You can encourage bacteria into the area, which can also cause scarring and cause hyperpigmentation.
Hey, my name is Falayemi and I'm getting an extreme blackhead removal procedure, but before we get into that, subscribe down below. My skin is very oily. I shine like a disco ball sometimes. I've never had acne throughout high school. It's really been within the last 2 years that I've started to notice that I've had acne. I want to get my blackheads removed because I know that's the first step in being able to clear up my skin and making my complexion even.
When we have those deep blackheads, medications can help. Sometimes if they're quite deep, you really have to manually extract them to get good results. Hi, my name is Dr. Michelle Henry. I'm a board-certified dermatologist practicing in Manhattan, New York. So this is a really comfortable procedure. I think a big part of pain is actually anxiety. We get so worked up about what's coming. And what I do is I really talk my patient through the procedure, because I think if you can expect what's coming next, it really reduces your perception of the pain. Hi, I'm Dr. Henry. Nice to meet you.
Nice to meet you. My name is Fola.
Nice to meet you, Fola. So what we're going to do today is a blackhead extraction. Very simple procedure. Sounds far more dramatic than it is. So I take 2 approaches and we'll do both on you, and I'm interested to hear how it feels to you.
Okay.
Sound good?
Yes, thank you so much.
Any questions for me?
No, I'm excited. Perfect. I'm very excited to work with Dr. Henry, most importantly because she is a black woman, I'm a black woman, and who else is more qualified than her than to do this procedure on me and tell me what it is that's causing my acne.
So Fola's skin is a little bit oily, which is what we expect. So I think she's going to be very happy with the procedure. She's going to tolerate it well, and I'm excited about doing this for her. The first step is to cleanse the skin. So we know that bacteria plays a role in acne, and what we don't want to do is reintroduce more acne into the clogged pore. I used an 18-gauge needle. I'll introduce it into the pore. So I use 2 approaches. I'll use 2 cotton-tipped applicators to evenly apply pressure and encourage that clog to be removed. Or I will use what we call a Komedo extractor. So the Komedo extractor also allows for even pressure around the pore to allow that clog to come out easily and gently. Another reason that I nick the pore first is because I want to reduce the amount of pressure that is required to get this out, to reduce any trauma to the area so that we don't damage the pore and cause enlarged pores or scarring or hyperpigmentation. And that's why I always encourage my patients not to do this at home, because it is very difficult to make sure that you have even pressure. And if you don't have even pressure, what can happen is that that clog can actually go backwards, and that can cause more inflammation. Actually puncturing the pore, I use a tiny needle and you barely feel it because it's so superficial. What's probably the most uncomfortable is actually the squeezing. It's mild discomfort, nothing extreme, and most tolerate it really well. It doesn't take a long time, so we don't have to numb the skin because it's very comfortable. So you walk into the office, within 5 or 10 minutes you're all done and you're home to enjoy your new blackhead-free skin. So you're going to be a little puffy. We have some areas that are a little bit red. That's going to subside slowly, even in the next few minutes, definitely by tomorrow. I can tell already that you're a little bit smoother. We're not seeing as many of those open pores. Even with a little bit of puffiness, I can see that you're going to look really good.
Thank you so much. I really appreciate it.
It's my pleasure.
So the procedure is over and I'm really happy about it because my face is numb, but that's okay because I know I'm going to see the results in a few days. I'm really appreciative of Dr. Henry for what she did, and I'm just hoping that, my skin will get better after this.
So the good thing about the blackhead removal is that there are minimal side effects, if any, and really very little potential for any long-term consequences. So really lots of upside and very little downside.
For anyone who's afraid of getting an extreme blackhead removal, I would just say try it, especially if you care about your skin and you want it to get it better and you want the best optimal health you can, I'd say just do it. Suck it up, it's 5 to 10 minutes. Thanks so much for watching my procedure. If you want to watch more videos, click here and subscribe here.